Tim Bennett here from the Cortland Voice. I'm here with Dr. Eli Finkelsztein from Cayuga Health. Doctor, how are you today?
Hi, Tim. Thanks for having me. Doing well.
Good, 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 good. With the weather being, nice and everything in the southern tier, Cortland, Ithaca area, everyone wants to go outside, but some decide to travel. Traveling is your expertise, travel medicine. Tell us what travel medicine is. Or
That's
actually,
right.
I apologize. Before we even get to that, we got to know who you are. Tell me, forgive me, I can't just jump right at it. Tell me about yourself, doctor. Tell me something.
Thanks, Tim. My name is Ali Finkelstein. I'm an infectious disease specialist. I see also patients in primary care. And one of the areas of infectious disease is focusing on travel medicine. And you mentioned it. We all want to have international travel and go out and enjoy, but we want to do it in a safe way. So that's precisely what travel medicine is to help people decrease the risk associated with specific travel. That is infectious diseases, food-borne infections, management of their chronic conditions, or any other travel-related health concern. So travel medicine focuses on that, providing vaccinations, medications, or any other health advice to make sure that the travel that people are going to do is done in the safest way possible.
Okay. Many are about to travel for the 4th of July. That's coming up. Many are traveling for graduations. Some have families who study abroad, things like that. When should someone consider, definitely seeing you for, for your expertise on travel medicine?
General rule of thumb is the earlier the better. I would say at least 4 to 6 weeks before the upcoming travel, so that if someone is going to receive a vaccination, it allows the immune system to get that protective effect before the travel. I
Mm-hmm.
would say that if last minute travelers need recommendations, they could still benefit from the vaccinations or medications that we provide. So in general, earlier is better, but if last minute is needed, it's also beneficial.
Okay, good. So plan out. So everyone listening, plan as far out as you can. But if worst comes to worst, see what way you can manage or do what you can best with the time that you have. Understood. So tell me this. What are the misconceptions that many have with, travel medicine? Because many, they might Google Wikipedia on Wikipedia to find something out, or their friend saw something at their local pharmacy. Hey, this comes with 24 capsules, 48 if you're lucky for the whole family. And it says that you'll be okay on a plane or you'll be okay in a car. I mean, that 30-second commercial that they saw or that ad in their flyer that was emailed to them versus you who did what, maybe 6, 8, 10 years of schooling, who has the well knowledge. Why should they how do we convince them, not even convince them, assure them that you know it's wiser to go see the expertise, the one with the expertise in
Yeah,
some,
absolutely.
versus just going off of a Google search.
Yes, absolutely. I think some of the misconceptions, as you pointed out, are believing that just staying healthy or just taking preventative medicines that you can take over the counter, like vitamin C, would be sufficient to prevent infections in travel. But as a matter of fact, there are a lot of conditions that are unique to the location that you're going that you might not find on a routine Google search, or you might not find at your local pharmacy. Other misconceptions are specific vaccinations. Some people have an aversion to, don't like vaccinations, or they say, I already had the ones that I needed in childhood. But as a matter of fact, there are vaccines that are specific for travel, for parts of the world where you can get diseases that are unique to that place. So I think it's really important, the conversation that we're having, to put that information out there, saying no, you should actually seek out to your general practitioner first, and also consider coming into a travel clinic to get this information.
So if someone did want to, set it up and come see you right away about their excursion, about where they're about to travel, would they come directly to you, or do they need to see the primary care practitioner first?
No, we do take self-referrals.
Okay.
So patient
Come
can
right
come
to
to
you.
me through by contacting our office, and we're not the only one. Ours is located in Ithaca. I also have a practice in Cortland. Um, and but also contacting through your general practitioner if you, I mean, if you're in an area where you can't reach to us, or there's any constraint, general practitioners might be able to give some of the information, but unfortunately not all. And they also might not have the vaccinations that are needed for some parts of the world.
Okay. Now, how can travelers stay proactive about, like, their health, and that's, the person from the leader of the pack to the family members, friends, everybody. How can they stay proactive on things, before the trip, during the trip, and then sometimes you don't see things right away after the trip.
Definitely, you put it, yes. So the way to do it is before the travel, you should first, I'm going to give some resources of where they can find information. The reliable information that you can find comes from the CDC, from the World Health Organization, and in the International Society of Travel Medicine.
Okay.
So they provide up-to-date travel advisories. So you want to search the place where you're going and make sure that there's not special health advisory for that area. For instance, we remember the ones that happened with Zika a number of years ago, or Ebola. Those were only specific for certain areas of the world. So those are the things that you should check on your own.
Okay.
Secondly, you should schedule a consultation with a travel medicine specialist, because you will be able to get the necessary vaccinations, or you will be able to get the necessary prophylactic medications. One of the most common ones that we send is malaria prophylaxis. Malaria is one of the most common infectious diseases in the world that can be prevented by taking a specific medication. Now, during the travel, there it's important to use our common sense, but also like practice good hygiene, avoid risky foods and water sources, um, using insect repellent and long sleeves when possible. Even with those best practices to avoid mosquitoes, I mean, we do also want to enjoy our trip. So that's why things like malaria prophylaxis provide additional coverage. And also during the trip, like stay up informed about the local health risks of that area. And as you mentioned, for after returning, we need to monitor our symptoms and seek medical advice if we notice anything unusual. So those are the best things to stay proactive. As you mentioned, it starts well before traveling. It involves scheduling a consultation with a travel medicine specialist, taking the vaccinations, medications, and then being as safe as possible during the trip. And also enjoying, right? We also want to enjoy the trip.
Got
And the
it.
best way to enjoy it is to stay safe.
I love it. Doctor, any closing words that you'd like to give the, greater Cortland community?
Yes, that I love practicing in Cortland, and that we're happy to see any patients that are interested in international travel at Cayuga Health, and that yeah, the best nowadays with increasing globalization and ease of which diseases can go from one place to the other and go across borders. We saw obviously what happened with COVID as well. We've all gone through all these scares. So best way is to be safe, um, and to be as safe as possible to be able to enjoy our travel as much as possible. So I would love to be able to help that in the best way possible, the best way I can.
Doctor, thank you for speaking with myself and the greater Cortland County community. Cortland, Ithaca
Mhm.
community. And to everyone watching, thank you for choosing the Cortland Voice. If you, once again, if you're going to travel, travel safe. Make sure you see the doctor. And for those watching, thank you for choosing the Cortland Voice. God bless. Thank you.
Thank you, Tim.